Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the public health update with data accurate through June 30th, 2022. This week, I'm going to reverse things a little bit and start with a report that is not COVID related. And I'll talk about what the U.S. Preventive Services Task Force has recently said about the risks and benefits of multivitamins and other supplements. And then I'll talk about whether or not we need to keep paying attention to COVID-19 data. Well, recently, the United States Preventive Services Task Force has come out with a very important set of recommendations related to vitamin, mineral, and multivitamin supplements to prevent heart disease and cancer. And this is a really important issue, and I'm a little bit worried that it got lost, and apparently were other issues going on in the country in the last couple of weeks, and folks weren't paying attention to this report. But it's really important because obviously heart disease and cancer are the two leading causes of death in America, accounting for about half of all deaths. And vitamin deficiencies have been associated with heart disease and cancer. So you would think that if their deficiency is a problem, then folks taking multivitamins and supplements would be reducing their risk of cancer. And in fact, the industry, vitamins and supplements, is about a $30 billion a year industry. And about half of people, 52%, take some sort of vitamin or supplement. So what did the U.S. Preventive Services Task Force determine? Unfortunately, they concluded that there's insufficient evidence to determine the balance of benefits and risks in terms of supplements and vitamins for heart disease and cancer. Basically, the evidence is lacking. And so what they're not saying that necessarily there are particular harms, but they're saying that the data on a multi-report analysis did not show benefits from supplements and vitamins in terms of reducing heart disease and cancer deaths. And so one might reasonably conclude, well, then it's still okay to take them. I mean, they didn't find particular benefits, but are there any harms? And unfortunately, they said there is little evidence of harm, but there are some specific ones, particularly beta carotene by people who smoke or have had exposure to asbestos, risks of moderate and large doses of vitamin A in terms of liver and toxicity to the unborn, and risks from vitamin D as well. And they conclude that the potential for harm for other supplements at high doses should be considered. So again, what they're saying basically is based on all the evidence that we have, there's no good evidence that vitamins and supplements reduce heart disease or cancer. And there are some, though perhaps small, health risks. But then some might ask, well, even given these concerns, really, is there any other substitute for taking vitamins and supplements? And in fact, there is. The Department of Health and Human Services and the American Heart Association both say, yes, it is important to get vitamins, but you can get them best from a healthy diet. So the report is not particularly reassuring in terms of heart disease and cancer. One could argue that there are other benefits from vitamins and supplements, and certainly that may well be true. But again, for those of you that are taking them for the purpose of reducing heart disease or cancer deaths, unless you have a specific documented deficiency, there's probably no benefit. The second question this week is related to whether we need to keep paying attention to COVID data. We've been doing this now for over 2 years. And the answer is yes, because the pandemic isn't over. And the natural history of the pandemic is that it waxes and wanes over time. And you can see these peaks and valleys. And if you look closely there at the end, the last couple of days globally, it looks like we may be seeing an increase in deaths again. Over 6 million deaths, about 1,350 deaths a day. It's about 150 more deaths a day than last week. That may just be a reporting phenomenon. But again, the pandemic clearly isn't over globally. In the US, if we look at cases, you can see for the last month or so, we've had pretty much the same number of cases. So it's not showing the spike pattern that we've seen before, but it's also not going down to zero. But perhaps the thing that worries me most is hospitalizations. On the left, that up and down curve shows you all age groups. But on the right is the one that worries me. And that is for old folks, those 70 and older, the hospitalization rate is going up. And it's at one of the higher points that it's been since we've been recording it. And hospitalizations are not dependent on testing. They do reflect what the impact of the pandemic is. Fortunately, in terms of deaths, we haven't seen a significant increase in the US for the past 3 or 4 months. We've seen a sort of a steady number somewhere in the 250 to 300 range. But again, the hospitalizations are what worries me. In terms of where the cases have been in the last few weeks, we've been watching. They started in the Northeast and they seem to have come down. And then this week, looks a little darker in the Southeast, in Florida, and in the West. Now, remember, a year and a half ago, it was really this wave started down in Florida and came up. So we'll keep our eye on this over time. So the pandemic isn't over. It does wax and wane. We are increasingly seeing reinfections, people who've been infected before getting infected again. And perhaps one of the most important reasons to pay attention to COVID is we simply don't know yet what the long-term effects are. There's reports of impacts on diabetes and Alzheimer's disease. These may be borne out in time. They may not be, but it's certainly something to pay attention to. And perhaps a more esoteric area but of interest to me is the COVID vaccine clearly reduces serious outcomes, but it doesn't appear to reduce infections. And a question I have is, is that true for other diseases? Is it true for measles and polio? Are we simply preventing serious outcomes? We've always thought we were preventing infections. So again, something to pay attention to over time. But ultimately, we simply don't know what future viral mutations will produce. Will a future of SARS-CoV-2 become more like other coronaviruses that cause the common cold, or will we start seeing more serious illness? We simply don't know at this point. So at this point, we do want to pay attention to the data. Now, what do both of these stories have in common? What they have in common is that sometimes, even when people see good data, we don't always see them make good decisions. The data on multivitamins and supplements is pretty limited. There are some situations where they may well be indicated, but this report is discouraging for people who had hoped to see some evidence of reducing heart disease and cancer. And the same is true with COVID, right? We know that the vaccine reduces serious illness, but still, we see folks, perhaps a third of folks, not get the vaccine at all. Now, our job in public health isn't to nag people into doing it. Our job is to share accurate data and empower people to make their own good decisions. So I hope you'll look at what I've done this week and say, okay, I'm sharing the latest information from the United States Preventive Services Task Force. If you choose to act on these data, that's great. If not, that's fine. As always, I would suggest before you take anything, a drug or a supplement or over the counter, talk to your healthcare provider. Figure out what is beneficial for you. If it's a vitamin or a supplement, great, do that. But again, take the data as they are and act on them appropriately. Great deal more information about public health issues on the website. If you enjoy these videos or know someone who might enjoy them, please feel free to share them or contact us and we'll add the other person to the mailing list. As always, I'd like to thank Dara Young for editing, producing, and posting this video. And again, I'm trying to answer questions that have come in. Many of you have asked me questions about issues other than COVID. I'm going to try to address them in the future, especially if the response to this video and the last couple of weeks is positive. I look forward to hearing from you. And until next week, please be well.